Welcome to our Inspiring Conversation series. Today, we are honored to feature Dr. Syed Hussain Fayaz, a visionary leader whose entrepreneurial spirit and dedication to social impact are shaping the future. As the CEO and founder of Oneness Education, Community and Research Foundation, Dr. Fayaz is on a mission to create 100,000 jobs, championing nonprofit initiatives that drive change. A serial entrepreneur and innovator, Dr. Fayez's work spans healthcare and business education, where he imparts wisdom and ignites innovation. Join us as we explore his journey, insights, and the powerful impact of his work. Welcome, Dr. Fayez.
Thank you so much. If I may ask, I forgot to ask, how can I call you? What's the best way to?
My phone number is at the email.
I
At the,
mean, regarding
at
how
the,
to, yeah.
at the
I
end
mean
of
your
the.
name as such. I mean your name. Sorry.
Oh, sorry. My name is Shuman.
Human. Okay. And you can call me Syed. Fayaz is my surname. It's my father name. My bad. I should have told you beforehand.
No, no, it's okay. It's okay.
Human.
It's it. Dr.
Yeah.
Syed. No worries.
Yes. Yes.
So,
Thank you so much.
thank you. So
Yes. Yes, Suman.
our first question as we start will be, what sparked or inspired the idea for starting your foundation, and how does it connect with your passion for healthcare, Dr. Syed?
Yes. Yeah. Just to give a short introduction about myself, I'm a medical doctor from India, and I've been practicing in India after completing my graduate and also my residency. So I've been practicing close to 4 years. And I was also teaching in SRM University for a medical graduate, dental graduate. And then after that, I wanted to learn more about pharmaceutical industry and clinical research. After completing my residency, I embarked my journey on pharmaceutical industry as a medical advisor, where we will be a bridge between the pharma industry and also the doctors who are there on the ground. So in a way that we provide the doctors with the recent update. So I worked under in Novo Nordisk organization, and they are the world leaders in terms of insulin production and innovation to treat diabetes and uh, heart disease, Alzheimer, obesity. It's an amazing organization. So I worked there as a medical advisor for close to 2 years. During this process, I was just trying to look into the other countries where for me to migrate and just proceed to see what are the better opportunities for me and my family. So one among that was Canada. So during that time, because of COVID, there was no immigration was happening as such. So I chose to take a just 1 year of course about leadership in healthcare professional. So after coming here, I studied my course in Confederation College. So when I landed here, I was really excited to learn about the Canadian system because we all know Canada has one of the best healthcare system. And Canada has been always been a forefront in terms of providing proper rights for their citizen, the freedom and the freedom of speech or freedom of whatever they wants to follow, and the amazing healthcare system, publicly funded. So I was excited to learn about the healthcare system. But the reality, once we started, we could always, it's like when I was staying in my country, I thought the grass was greener on the other side. So after coming here, we could see more in detail about what's the ground reality here. And still, it's the best in the system, but still, I learned a lot of challenges here. So that's when I realized that for healthcare, internationally trained healthcare professionals, when they come to this country has a huge variety of challenges compared to Middle East or Singapore, Malaysia, compared to those countries. The challenges were completely different in North America. The barriers were different. So once I learned that, I understood that it's not going to be and I never expected to be a cakewalk in terms of this journey. But still, I realized that it's going to be a time consuming and energy and financial. It consumes everything about whatever you could provide to this. Then I could see similar to me, many were there in the same position. Thousands and thousands of people from internationally trained healthcare professionals. I could see them in the same position. At the same time, I could see that healthcare has a crisis in this country in terms of human resources, like a labor shortage, and followed by long waiting times and primary care crisis and specialist crisis. I could see that. So I was just trying to see that how we can leverage an internationally trained healthcare professional, which would try to provide some kind of solution for this country. That's where I was able to bring in this Oneness Education Foundation with a mission to improve this amazing country's healthcare system. It was to improve the quality and this country's healthcare system in any way possible. And we are primarily focusing on leveraging the internationally trained or educated healthcare professional. That was the initial idea in that aspect. And whenever I spoke to my professors and including the member of parliaments, I had a couple of interaction with them when they were acknowledging that the challenges, and they were also saying that we have to dependent on the internationally trained healthcare professional. So I thought it's better that we provide a platform for people who are internationally trained healthcare professional. We provide the platform with all the information for them to embark the journey on Canada. That's where this initially started. Yes. Thank you so much. Yeah.
No, that was very inspiring to hear because whenever you find a different ground reality, rather than retreat, you have chosen to go ahead and in while definitely as a way of survival, you didn't survive. You are trying to help others to survive and flourish. That's a very 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 big signpost for positivity and everything. So great to know. Great to know. So, how does your foundation contribute or make a difference as you are speaking? And it was very evident from your conversation that how does your foundation contribute or make a difference in the health and well-being of the communities you serve?
Amazing. That's another amazing question. I think I left out a part about in the last question about how this foundation aligned with my passion as a healthcare professional. So those two questions is it's almost it's similar in a way of for me to have the connection. So me being a doctor, I thoroughly enjoyed interacting with the patient, and uh, I could see that once we understand what patient is going through, what are the limitations they have, once we understand that, we can have a more impact. It's not just about my technical knowledge or my knowledge about a human system and everything. It's also about, I learned that it's just not about that aspect. We also need to use the emotional intelligence and see that what are the challenges they have. So once, why I'm just bringing back to the previous question is that, so I learned that there is more to healthcare than just treating with the medicine. That's the very first thing I learned. And that's what made me to embark on the journey in pharmaceutical industry also. And during me practicing as a medical advisor, even though I don't treat the patient directly, when I could share the update about the new medication, how the new medication is better in terms of efficiency and also safety compared to the previous medication,
Hmm.
I could see that if the doctor where we are working with them, if that doctor is providing the updated medication with the which has a lesser side effect and more efficient. And I could see that instead of me a single doctor treating patient, when we could enlighten like many doctors, and when they treat the patient, which reduces lot of side effect, which reduces the complication for the patient in case if they have diabetes, they have a long-term, short-term complication. So when we work on this medical education activity or guidance, we could see that many patients get benefit out of a single person. So this made me to again realize that even if a healthcare professional, if they can't end up becoming a doctor or end up becoming a regulatory professional like a nurse or pharmacist, because there's a lot of challenges. Okay, challenges are n numbers. The contributing factors are like it's hugely varies. That's when I realized that the moment we have uh, like a third person perspective, I could see that when we help out the internationally trained healthcare professional, we still be a part of the community in term of working towards public health, in term of preventing the disease or a health promotion. And Once we leverage their education, their experience, instead of they doing a survival job, an odd job, the moment they lose the trust on themselves or trust on the system, they leave out of the healthcare. But with the Oneness Education Foundation, what we are trying to build is any internationally educated healthcare professional, we want to let them know you chose healthcare because of you had that service mentality.
Yeah.
You were able to empathize with the people. You wanted to be a compassionate a human. That's why you chose healthcare professional. That's why you chose to do so many service and so many hours of work you have put on improving patients' life. I wanted to acknowledge that. I wanted to tell to those healthcare professionals, we could still have that impact. You could still be in the noble profession. That's where we think that once we sit and talk to them, we just wanted to remove all the challenges, yes, some professional might have. If someone says that they have a 4 or 5 challenges for them to become a healthcare professional, in Oneness Healthcare, in Oneness Community, sorry, in Oneness Education Foundation, we wanted to remove those barriers. Even if we could remove one barrier for someone, it could still have that impact. Once they land in being a healthcare system, just going to end it. Once they are in the healthcare system, it would in turn improve the community. It would in turn make the community more healthier. That's what in Oneness Education Foundation we are trying to do.
No, definitely, definitely. And I really like the term you used, emotional intelligence, because
Yeah.
it's a sheer coincidence that this morning I have posted an article in my LinkedIn profile as emotional intelligence and regarding how we can develop the organization. Obviously, from HR perspective, I'm from HR background, but as you said, education and educational leadership in healthcare, definitely emotional intelligence is the foremost important thing. And that is why you could use all the word empathy, compassionate, and everything. Fantastic. Fantastic to hear. Like as if you are speaking exactly the same thing in the health sector. So thank you. Thank you for that. Could you share some success stories of from your foundation that have made a significant or to say big impact in people's life? Some success stories, please.
Sure. So just to provide us the what are the services we are providing, just to share that point. The key services are to start with. We have our own app where people can join in this app and they can be a part of this community. The people who was successful and currently who are practicing, they are there in this app. They'll be able to. So these people are forerunners. They were able to break through those barriers, and they were currently in the healthcare system. We have that community. It's a circle app where we have oneness community. Now these people, now the people who are right now having challenges, they can join in this app. We can discuss and share that what are the challenges. We can provide the information. So it's our own application similar to LinkedIn. It's only healthcare professional. Only we are there here in that app as it. That's the first service we provide uh, to provide that psychosocial support. Then second one would be we also provide the uh, many, even though they have experience back home in this country, they expect certain certifications, certain trainings. So we also working towards providing the CPR first aid. We are yet to start that to provide CPR first aid and EMR, electronic medical recorder training, and clinical research and health promotion training. We are currently working towards creating this course. So this was the project which we applied for Black Founder Network. So that's where we got selected as a winner for the BF and Accelerate program. I would share the link to you on that. We got selected for that. So we wanted to provide this kind of training so that they can land into their first healthcare job. They have that training. They learn how to communicate the ethical point of this country. This country has their own ethical guidelines. So how to protect the personal information of the patient, even though we protect across the world, but this country has additional requirement in terms of how to maintain the privacy and confidentiality. We provide those training. So that's the second component. And third component, we applied for the charity registration. So that's a major milestone for us. Being non-profit is the one thing, but getting the charity approval and getting the charity registration number is RR number is a completely different ball game. So we are waiting for that. We'll get the approval in next 2 to 3 weeks most probably. So once we have that, we wanted to work towards the crowdfunding because for someone to become a doctor or a pharmacist nurse, we need a 5,000 to $50,000. The number is scary as such. So we wanted to provide funding also for these amazing people, uh, so that they'll be able to use that money to write the exam and take the courses. We wanted to do this as a interest free. So we want to make sure that it's not part of the interest aspect because it will put more burden on these amazing healthcare professionals. We have already did for two dentists. It's already been shared in the LinkedIn also. We have two dentists where we have funded for them and for them to start their dentist process. So, like when they are paying back, they're already starting to pay back just as a monthly installment. We just want to keep it easy on these people, these amazing doctors as such. And that's the third thing. By doing the crowdfunding or by using the charity foundation, we want to provide that support, financial support for this healthcare professional. And the last one would be we have our own job portal because we want employers who are amazing employers. We want them to know that we have a platform. Kindly give us an opportunity. So this is solely focused for the healthcare professionals where they can showcase their skill. They can have their video. They can showcase their skill. And employers can directly put the filter. It's not like a LinkedIn or Indeed. Here, healthcare professionals are the product. So we are the product. So any employer can put the filter according to location, availability, experience, language. They can put the filter and they can recruit. We built from the ground. We build this product. It's called Compassion Act. So in terms of success story, I just wanted to say that we also provide immigration support. So we have close to 10 to 12 professionals where we help them to get a PR from creating their profile and everything. That's the very first thing so that they can be a permanent resident and start working on this. And we have helped close to 15 to 20 professionals to get a job in their field by helping them in terms of updating their resume and having mock interview for so that they'll be confident in terms of doing that. That's the second part we have done. I already shared about the funding what we have provided. These are the success stories. And having that community, we have close to 100 people who are there in the community. Having someone that's a huge success that where people ask about their challenges, their question, right away being answered by other healthcare professionals who are forerunners in this country.
Fantastic. Fantastic to hear that. And all these supports regarding you have your own app, you have helped people, you are helping people in certifications, you are applying for charity, and the job portal, the curated job portal is a big thing. So what are the some challenges that you have faced with your foundation and how you have managed to overcome them?
So in terms of challenges, I would always start with being consistent is the very first thing. Once you be consistent, so initially that was the challenge because we have our own family to take care. When you start any startup, and if it's more so non-profit organization, the first challenges would be we being consistent with our the other job what we do. But how we overcome is that by working with a team. So I have amazing team members from Dr. Vase, who is a co-founder. We have Director Glancy, who is a pharmacist, and also we have Priya, who is a physiotherapist. And we have Dr. Mariam Musa, who is also a director. And likewise, I could keep on adding many names. So we have a big team as such who takes responsibility and they themselves do certain things to cause that impact as an organization to improve the life of international healthcare professional. So that's how we overcome it by having a team who would support each other whenever someone is down to support each other. That's the very first thing. Second challenges, I would say that uh, regarding because to build something, we always need to invest. And the second challenges would be certainly a financial aspect. So in that, the best way to overcome is to doing the market analysis and knowing that whatever service we are providing in turn that will be benefiting the people and they'll be able to leverage the service. So we are still in the process in overcoming that. So only we are right now starting the certification courses to be self-sustainability. So in term of another thing is that in term of finance, we also have membership fees. It's like a monthly subscription, $6, something like $6. That also benefits in term of running our organization. People trust on our mission, and so that they'll be able to build this together, grow this together. And last challenges would be as a non-profit organization, people tend to depend on the grant. Uh, my good friend Dr. Vase, who is a co-founder, he always says that government has government government get too many people who raise the hand to them. Many NGOs ask to the government for the grant. So government can't obviously keep on satisfying everyone on providing funds for everyone. So in Oneness Education Foundation, what we are building is that for us to be self-sustainable. We are not like any NGO. If you see, Mr. Suman, in this country, all the hospital, all the public hospital, all the public college, these all are NGOs. It's surprising. From sick hospital, if you take any hospital, you take any public college, everything is a charity organization. They are NGOs. We don't see ourselves as some a non-profit organization which is just running to provide the redundant service. We wanted to be a organization which creates the job. That's where my tagline comes into a place. We want to be a charity organization which creates a job, which means we have to provide service and be a self-sustaining organization. So that's the last aspect in terms of challenging. So to build service, to build product, to be self-sustaining is a different ball game. We are in turn struggling. We are trying to collaborate and learn from other organizations. Yeah, that's the last thing they have to say.
No, fantastic. As I was listening to you as if you were telling our stories. So fantastic. So it was very good to hear. So from your last line of your answer of the previous question, so how does your foundation collaborate with other organizations in the healthcare field to reach your goal? Just to highlight.
Yes. So regarding the currently we are collaborating. We understand the service we provide. We don't want to have a redundancy. We don't want to duplicate and reduce the efficiency of other organization also. The very first thing we are making sure that we don't duplicate the service. That's the very first thing. So that initially we are currently collaborating with whatever service we are providing. We are seeing what are the other organizations which provide the same service, so that we can work together with those organizations, reduce redundancy, and grow together. So we have currently we are connecting with the CIDAR Healthcare Professional Impact Foundation, and we are collaborating with this organization. We are also wants to collaborate with the staffing agency, who have been a leader of like few agencies who are leader of this staffing agency. We want to collaborate with them to make sure that our members get the job and get the in-hand experience as such. So that's the, and I would say that for NGO collaboration is the key. We need to collaborate with other organization. So we are actively collaborating with many organizations to. Right now we are collaborating with the BFN, Black Founder Network also, to make sure to have that impact in the ground level to improve the people's life.
Fantastic. I really liked how you defined redundancy, that you said that we do not want to reduce other organizations' efficiency. I really liked it. Like it was really new to me. So thank you for that. So what are some future plans for your organizations? How do you envision expanding its reach and impact both? Please.
Yes. So that's the dream as such. What make our organization difference is we wanted to start our clinic. That's the that's something that we are very conscious and we are dreaming and striving every day to make sure that happens. We have two amazing physiotherapists who are part of our organization. We wanted to start a clinic on September. I don't know which way it's possible. It sounds September sounds just around the corner, but we wanted to start a clinic in term of the moment you start a clinic, It's a part of Oneness Community Foundation. Oneness Education Foundation ends at Oneness Community Foundation. So that's where we start all the clinic. We're starting with physiotherapists. Next year, we want to start a dental clinic and pharmacy and laboratory. That's a long-term plan. That's where we wanted to achieve in terms of creating job so that people can get that confidence. We can also provide them the training, internship in our clinic. Instead of we keep on depending on the other employer, we should become an employer and we should do what we are asking others. Okay. Instead of just saying that they are doing, why they are not doing, why they are supposed to do, we should come into that state and we should stand by what we have been preaching as such. So that's our mission in terms of creating job. And this country has the challenges in terms of research and innovation for many reasons. For many reasons. So we want to also work on the Oneness Research Foundation, where when we start a clinic, we wanted to conduct a community research and help. If we have a doctor from Nigeria or from Philippines, India, or Mexico, we want to help those amazing healthcare professionals to conduct a research, community research, and improve their communities' people health. Conduct a camp, conduct a medical education activity. So to collaborate with them, that's where One Research Foundation comes into a place that publish this result and showcase that it doesn't matter. You can become a doctor, you can become a nurse, but if you can spend like 1 or 2 hours in improving the public health or making sure that your community people has a better understanding of a better literacy of their health, how they can keep their health in a good condition with a culturally competent healthcare professional. That's the long-term plan if you have to just summarize it.
No, thank you. Thank you for sharing. And obviously, good luck with your effort of establishing a clinic down the
Yeah.
road in September. Hope everything will be going well with you. So, how can our readers get involved with your foundation and support its mission?
Yes. For us, uh, if we know someone, if you are a healthcare professional, or if you know someone who are a healthcare professional, we welcome everyone. We just wanted to make sure that it's not just about our organization. Similar to what your organization is doing, amazing, what you are intent to do, we want to make sure that people get the information and moving forward one step at a time. So when they join us, we wanted to make sure that you will get the information about how to be in healthcare. Start from those information. Even before landing in Canada, you can be a part of One's Education Foundation. The important part of this app, what I said to you, Mr. Suman, all the previous conversation also you can read.
Hmm.
The moment you join, you are able to access all the information, whatever the others spoke, whatever the training we are trying to build, be able to. That's what humans are. Start from I start from zero. Someone can after 2 years, someone can join Oneness. They can start at 40%. They get all the information readily available. So if you're a healthcare professional, if you wants to be there in the noble field, we are here to leverage. We are here to leverage your experience, and also we are here to provide all the support from the immigration training, anything you ask for. We are there to provide. Please
Fantastic.
join as a benefactor for the One's Education Foundation. Yes.
Um, Dr. Syed, somehow it is from the strictly from the business perspective, it is almost we can call it is an age of entrepreneurs. It is an age of startup and everything. So, what will be your advice from your learning experience and whatever you have learned from the very ground up? That what will be your advice to if you want to give someone who wants to start their own nonprofit in healthcare sector? What would be your advice?
Yes. Amazing question. First of all, I will not say I am qualified to suggest someone, but as per my experience, I'm
Yep.
not okay. As per my experience, I would say that start, register for it, start somewhere. Uh, the moment you start somewhere, you will start seeing all those challenges, but at the same time, you will see the solution also. Only when you know what is the barrier in front of you, you'll be able to provide solution. You'll be provided to break those barriers. So I would start with just register your business and make sure that your mission is clear. Only when you know that, imagine that, Mr. Suman, you are currently at your workplace, you want to go to your home. Only when you decide that what is your destination, that's when you will know that now what needs to be done. So I would say that register the business once you know that what is your vision and mission. And I would just end with adding regarding values. And I'm telling regarding the values of organization, every day it will be challenged. Every day your values will be questioned. If we are not going to be strong on the values, if we are not going to have amazing team who can question you, who can guide you, uh, who can have that rapport with you, so it's going to be we will lose the values down the lane. So in Oneness Education Foundation, we are completely focused on. We have amazing five values. We are focused on servant leadership. Our end point is to make sure that our team members they grow. Team members means our community, they grow together. So I would say that once you do these two things, then it's just a matter of time. We being consistent, we learning something about it, we keep on collaborating with people. I would say these four things that matter of time you'll be able to provide the service. It's the same with both NGO or profit. It's a same aspect. Yes.
No, fantastic. So, like very quickly, like very anecdotal point, register your business, try to have the solutions in front of you, whatever the barrier comes in. Your mission should be very clear regarding your values and everything, what you can contribute and your ideas. For example, you have mentioned another very good term that I really like is servant leadership. I really like that term. This is one of the most latest leadership theories. And you have an amazing team, and what you have to be consistent in the contribution and everything. So thank you very much for these suggestions. I hope not only for non-profit, many people who wants to start their own business for profit as well, they will be also be very inspired by your thinking.
Yes.
So thank you very much. Thank you for your
Yes.
time, and thank you for your sharing your experience with our leaders. And wish you all the luck for doing whatever you are doing and whatever your team is trying to accomplish. Good vibes ahead. Thank you.
Thank you, Mr. Saman. If I
Thank you.
have to just take a 30 more second
Yeah,
in a way that
please.
I wanted to start with in the name of the creator,
Mm,
but obviously I want to end this with uh, all praise to the creator who created this whole universe. All praise to the creator. Because of the creator, we are able to do this. And obviously, our parents. So,
mm,
thanks to my mom and dad, my siblings, who and my friends who helped me to have these values. And we have our tagline in our values in Oneness Education Foundation. That's what makes me to strive. I wanted to make sure that helplessness should be only towards our creator. I wanted to end with this helplessness. Any human, they shouldn't feel helplessness. The moment you feel helplessness, we let people oppress us. So in Oneness Education Foundation, we wanted to provide anything possible to this community, our community, so that they don't feel helplessness. Anything what we can provide them, let's provide them so that they can hold our hand and just move forward, and they will hold someone else's hand and move forward. So don't feel helplessness. God is here, and we are here to support you, which means any healthcare professional, in term even any humans also. But to start with healthcare professional, I
yes.
just wanted to end on that note.
Uh,
God bless.
thank you for that excellent message to the readers and to us all. Thank you very much for sharing your thought. Thank you, Dr. Syed.